Everyone. We are going to go ahead and get started here. Thank you so much for joining us for our webinar, Nourishing Minds, the connection between food insecurity and youth mental health in school-based health centers. As a heads up, we have a little bit of a longer runtime today to accommodate some additional content from our panelists. So we will be ending today at 3:15 Eastern time, so it's just 15 minutes past the next hour. As a quick reminder, you are all in listen-only mode, but we have activated the Q&A. If you have a question that comes up throughout the presentation today, we would love to answer it for you, either at our question and answer session at the end of the webinar, or just live to type. If you would like closed captions, feel free to press the closed caption button. And we do have some evaluation questions that we'll just ask you to answer at the end of our presentation to make sure that our next webinar meets all of your needs. Alrighty, so by the end of our 75 minutes today, you will understand the connection between food insecurity and its impact on mental health for youth and their families. You'll learn about unique initiatives in healthcare settings that are addressing both food and behavioral health needs. And you'll explore opportunities for youth-led food and behavioral health initiatives in your school-based health center. Alrighty, and my name is Harper Byers. I am a coordinator at the School-Based Health Alliance, and I am joined today by two of my fellow team members, Addie Van Zwal, who is a director at the School-Based Health Alliance, and Sarah Mills, who joins us from Share Our Strength, a division of No Kid Hungry. And with that, I will pass it to Addie to introduce our lovely presenters for today.
All right, thank you, Harper. So today we're super excited that we have Dr. Cindy Leung with us from Harvard. We have Nicole or Dr. Casabaro from Winnipeg University. We also have Rachel Jones and Celeste Mascari, both from Farm to School of Park County. So they may also introduce themselves as we get started. But before we do that, just wanted to provide a little bit of background about who we are. So Harper, if you can go to the next slide. The School-Based Health Alliance is the national voice for school-based healthcare. Since 1995, we've been working to improve the health of children and youth by advancing and advocating for school-based healthcare, really recognizing the importance of bringing together health and education. And our goal is really to expand and support school-based health centers across the country. Sarah, do you want to provide a little bit of information about No Kid Hungry?
Sure. Thanks, Daddy. And hi, everyone. Really happy to be here this afternoon. Share Our Strength is a national nonprofit dedicated to ending hunger and poverty for children and their families. We created the No Kid Hungry campaign to make sure that every child in the U.S. gets access to the healthy foods that they need to thrive, as well as strengthening state and federal meal programs that children and their families depend on. We work across all 50 states with organizations by providing grant funding, advocating for better policies to meet families' needs, conducting research, and providing technical assistance and support to schools, state agencies, nonprofits, and healthcare organizations in their work to end childhood hunger. And that was really what led to our partnership with the School-Based Health Alliance over the last couple of years.
Sarah. So as she alluded to, we have been working with No Kid Hungry for the last 3 years. And so we have continued this year to work with our 2 state affiliates, Ohio School-Based Health Alliance and the Youth Healthcare Alliance, to expand their work on evaluation and sustainability. Last year, we supported them in launching their own state learning networks, which was really great. We are going to be launching a national survey to learn more about what school-based health centers are doing across the country to address food security work. So definitely stay tuned because that will be coming soon. And then another part of this work was really launching this webinar series. So the first 2 webinars have happened already, and those are available in our library on our website if you're interested in checking those out. And then today we are focused on one of my favorite topics, Nourishing Minds, the connection between food insecurity and youth mental health in school-based health centers. So with that being said, I'm going to pass things over to our first speaker, Dr. Leung.
Great, thank you so much. And hi, everyone. I'm really happy to be here as part of this panel. I want to thank the School-Based Health Alliance and Share Our Strength for inviting me to kick things off. And I'm looking forward to hearing more discussion from the other speakers and from all of you about how we best address food insecurity in children. So a little bit more about me. I am an assistant professor. I study primarily the health impacts of food insecurity in children, but also as they age and outcomes across the life course. I got started in this work because I used to work at a large food bank in Oakland, California, where I was coordinating food distribution programs and teaching nutrition education to our clients, advocating for SNAP and WIC, and was just really inspired to continue to find ways to alleviate food insecurity and all of its dietary and health consequences in more strategic ways. And so today I'm going to share with you some research that I have been doing around food insecurity and mental health, and how we can use this information to then better or complement our existing interventions to address food insecurity so that we might have longer lasting outcomes. Next slide. Okay, so I'm sure we're all familiar with the definitions, but I thought it might be helpful just to lay them out before I get into the more nuanced details. This is the first definition of food security that was adopted in 1974 at the World Food Conference. And you can see in the first definition, it was really about availability of adequate world food supplies of basic foodstuffs to sustain a steady expansion of food consumption and to offset fluctuations in production and prices. There's actually nothing in here about individuals or families or health outcomes. And it wasn't until about 20 years later, next slide, that the concept of food security as it applies to the individual was adopted. So at the 1996 World Food Summit, it was defined that food security exists when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. But there's a lot of components in this definition of food security. All of these things have to be present for us to be able to achieve food security. And if any of these components are missing, then we by definition have food insecurity. So the USDA defines food insecurity as the limited or uncertain availability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So again, if any of these components around access, nutritional content, acceptability of acquiring foods, if any of those are missing, then the concept of food insecurity comes into play. Next slide. And so we measure food insecurity by asking individuals or families how often people in their household endorse these various experiences. And these were conceptualized from parents of children who were experiencing periods of hunger, and they reported these were things that they did when food was running out. So they worried their food was going to run out. They couldn't afford to eat a balanced meal. And then the more behavioral manifestations, they might eat less, skip meals, reported feeling hungry but didn't eat, losing weight, all because there wasn't enough money for food. And of course, the most severe circumstance is when someone reports that they didn't eat for a whole day because there wasn't enough money for food. And if a child reports any of these, or if the parents report that the child experienced any of these, then it really is an automatic indicator of severe food insecurity. Next slide. Now, who experiences food insecurity? We know from national reports from the USDA that these are all the characteristics of individual or households with food insecurity levels higher than the national average. So in 2023, it was reported that the national average was about 13%. 13% of all US households at some point in the past year had experienced food insecurity. These are characteristics where their prevalence of food insecurity were all higher than 13%. So households with children, particularly young children under age 5, households with children that were headed by a single parent, whether female or male, all of those were risk factors for having higher food insecurity, as well as a Black or Hispanic headed household and households with lower incomes. I'll also add that these characteristics do not change. So every year when USD releases their report for the previous year, these are the same characteristics where we know these households have higher levels of food insecurity than average. Next slide. And I mentioned that households with children is one of those risk factors. And in fact, households with children always tracks higher in terms of food insecurity compared to the US. So this is just a figure showing data from 1998 to 2016. If we continue this on to 2023, the patterns would be exactly the same. When we have spikes in food insecurity, like we did with the Great Recession, like we did with the end of SNAP benefits at the end of COVID, we saw similar spikes in food insecurity, and we definitely saw a higher spike for families with children. Next slide. And I'll just remind you all that eliminating or alleviating food insecurity in our country is tied to our Healthy People 2030 goals. So we have national benchmarks where we are hoping to achieve far lower levels of food insecurity. One of these goals is to reduce household food insecurity and hunger to 6%. As mentioned, we are currently at 13%, so we are actually getting worse. Our trends from the last few years have showed that food insecurity is increasing, so we're moving away from that target. Next slide. And we're also trying to eliminate very low food security in children. So having a target of 0, we are currently at 1%, meaning 1% of households actually report very low food security, including behaviors that are reported by or that are experienced by children in terms of reducing their food quantity or quality as a result of not having enough money for food. Next slide. The food insecurity has been linked to a myriad of health consequences for adults. I've kind of grouped these by domain. And so on the left, we have like behavioral manifestations of food insecurity, and that's dietary deficiencies, poor diet quality, worse sleep, lower physical activity, higher levels of smoking. And so those are all health behaviors that we've seen in populations with food insecurity. It's also been associated with lower overall health status, poor physical health status. On the right, on the top right, there are some mental health outcomes. So generally, food insecurity is associated with poor mental health status, greater psychological distress, as well as anxiety and depression. And then for older adults, we're actually seeing several studies now report lower cognitive function and potentially higher risk of cognitive impairment and dementia. In the bottom right, there are more diet-related chronic diseases that have been associated with food insecurity. So that includes obesity, which is predominantly seen in adult women populations, hyperlipidemia, hypertension, diabetes, and among people with diabetes, food insecurity has been associated with poor glycemic control. Much of this comes from large-scale observational studies. And so, as researchers, we do our best to control for other factors that might be influencing these associations. We're not saying these are causal, but at best, we're saying that all of these conditions or outcomes are detected at higher levels if the population is reporting food insecurity. Next slide. There's also been several consequences for food insecurity in children. And there's actually been a long list of outcomes that have been reported. Um, and these are some that I found just doing a quick lit review of what the consequences of food insecurity for children. Could you click one more time? Thank you. So like I said, this is not an exhaustive list. These are outcomes just from doing some quick lit review searches on what studies have found when looking at child food insecurity. And I'll point out that these outcomes kind of span the range from infancy through adolescence. They also fall into different categories of kind of developmental outcomes, um, psychological, behavioral, physical, mental health outcomes. And so it's not just food related, food or nutrition related. It's not just kind of like poor diet quality or micronutrient deficiencies, even though those have been reported in the research. It really goes beyond just the need for food. Fine. When we think about why there are so many of these studies reporting negative health outcomes related to food insecurity in children and adults, we have to understand mechanisms. We have to understand why we think all of these associations are happening. And most of these studies are controlling for things like income, education for children, education of the parents, employment status, marital status, a lot of sociodemographic factors that we think predict food insecurity. Those are all generally accounted for in the study. So something about food insecurity is still saying that there are these significant associations with all of these outcomes. And so why do these associations exist? When earlier in my career, I did a series of qualitative studies where we talk with people who are experiencing food insecurity. We ask them questions about their experience, and we have them share more about why they might be in this situation or how food insecurity affects their physical and mental health. And one of the themes that emerged from this research is that the environment nudges us towards foods that don't support our health. Next slide. So as an example, this is a photo that was taken by one of my former study participants. And when I asked her why she took this photo, she said, I think people in poverty are being punished because they can't afford orange juice. They can't afford healthy food for their kids. They have to give them Kool-Aid and Sunny D, and that's sad. Next slide. These are two different photos taken from two separate study participants, but I put them side by side because it was just really striking to see how similar their experiences was. So on the left, you see this picture of a pack of gummy worms, 2 for $1, purchased at a convenience store. This participant said, I have 68 cents left on my EBT card, and these were 2 for $1. I felt bad because I didn't even have enough for a banana, but at least I had something to feed my child. And then the picture on the right is a picture of a food distribution at someone's residential complex. So this was a residential complex where a local grocery store would kind of drop off food Tuesday morning, 7 a.m. Residents could line up to get free food. And you can see the food that was available to them, the residents that morning. And they said, you can see all the bread and pastry options. They're filling and delicious, but not healthy. I keep bringing them home, even though I know it isn't helping me one bit. Next slide. And the last picture I'll show you, this was taken inside a grocery store. This is like one of those offshoots. It's like a little restaurant or kind of like fast food outlet that's inside of a grocery store. And on the very bottom, you see that sign, "You buy, we fry." There's a picture of EBT or SNAP. And the point of this is that if you buy a pack of raw chicken, you could take it to this um, little restaurant and they would fry your chicken for you. So even though you can't use your EBT benefits to purchase fried chicken, this is a little loophole where you buy the raw chicken with your EBT benefits. You could take it here, they'll fry it for you. You can bring home a basket of fried chicken for your family. And the participant who shared this photo with me said, everything that you can buy for your home to make a home cooked meal is very, very expensive. But soda and fried foods, they're cheap. When you go into the store, it smells like grease from the fried chicken hut. If you buy chicken from the meat area, they'll fry it for you. It's like, come in and get fat. No, buy this cheap soda. Don't buy all this other high quality stuff because we don't want you to make a decent quality meal. We want you to eat fried chicken and drink cheap dollar a gallon soda. So the participant was very angry that this was in the grocery store where she was shopping at. You could hear that through her description. Next slide. So why do these associations exist? Well, one prominent theme, as I mentioned, was that the environment is shifting us towards these foods that don't support our health. Another theme that I'm going to talk more about now is just that food insecurity is stressful. I don't think this is some like groundbreaking theory, but it's something that we don't pay enough attention to when we're trying to understand how do we solve food insecurity. Next slide. So I mentioned that I did some qualitative research previously, and part of this work is we actually talked with parents and children ages 7 to 14 at the same time, but in separate rooms. We asked them to share with us their experiences of food insecurity and particularly how food insecurity affects their mental health. Next slide. And so for the parents, as soon as we asked about their food situation, the stress of food insecurity came through very, very quickly. Every parent had a story to tell, and every parent said that it was really stressful to manage their food budget and manage all the preferences of their children and other household members and just make it all work. Next slide. Related to that, there were a lot of other themes around stress, or more broadly, distress, that came out from these various interviews. One was this feeling of powerlessness. So, and this was really in the context of food prices, feeling like you don't really have a choice to buy the healthy foods that you want your kids to eat because they're out of reach, they're expensive, and you're basically forced to buy lower quality food to make ends meet. Next slide. One of the parents in our study said, "We get tired of eating the same thing over and over again, but what can I do? Canned chili and rice, sort of healthy, but it's something we eat all the time. Hot dogs, again, all this processed food. We don't have a choice. I have to buy what we can make the most out of, what we can make last. Always the unhealthy stuff that we are stuck buying." This parent also talked about having to buy cereal at the drugstore because that was the cheapest place to buy cereal. And she could buy very sugary cereal for $1 a box, or she could buy a healthier cereal that had more fiber, more whole grains for $4 a box. And she said, I ended up buying 4 boxes of crap because that was all I could afford. And I felt terrible giving this to my children. Next slide. We also heard themes of kind of social isolation or alienation. People felt, adults described like not wanting to talk with their peers, their friends, their family members, even people kind of within their family, especially if it was a mother we were talking to, she sometimes didn't want to share this with her spouse because it was kind of the traditional gender roles of the father's going out to make the money, then the mother is in charge of kind of making that all work in the house, and so didn't want to burden their spouse with the struggles of making their food budget work. Next slide. We heard elements of feeling embarrassed, stigma, feeling ashamed. This was in the context of food insecurity, but also with how we would expect people to get resources for food, including standing in line at a food pantry, using food stamps at a grocery store. All of those things carry different elements of shame. Next slide. We heard several mothers and fathers talk about feeling sadness, feeling depressed, that this was just this constant cycle that they were going through, and there was no end in sight of like when things were going to get better. Next slide. And then finally, for parents, I think that this theme of guilt was really strong. Knowing that your children are supposed to eat certain things in order to grow and thrive, but yet a lot of those foods were seemingly out of reach. Next slide. I have a few more quotes. I'll share them with you before I move on to the next slide, and I'll let you read them to yourselves. Next slide. Okay, so I'll talk a little bit about the children's results now. And I'll say, like, when we started this research, we didn't know what we were going to hear. Again, our children were ages 7 to 14 in this study. The kind of prevailing notion was that children are protected from food insecurity, that parents are doing the best jobs possible, and they are making sure their children always have food, even if that means the parents are sacrificing their meals. And before we did our study, we had seen a similar study come out of South Carolina showing that children ages 9 to 16 were able to, they were aware of food insecurity in their household for across various domains. And sometimes the parents were not aware that the children were aware. And so we had a slightly younger age group, and we heard very similar things. So children were aware if their household was experiencing food insecurity. They noticed if their parents were eating different foods. They know if their family is getting SNAP benefits or if they're getting free lunch at school. They know when their benefits come in for SNAP because that's when they go and buy like their month's worth of food, and that's maybe when they can ask for a food item that they really wanted. And so that was the first thing that I wanted to establish with these quotes. So one 10-year-old boy who said, sometimes my mom didn't eat because we had to eat. She sacrificed eating her meal for us to eat our meal, and she never tells me. She just lets us eat, and she eats leftovers that we didn't eat. So a 10-year-old not having a conversation about this with their mom, but noticing the differences in how much they're eating. Next slide. A 12-year-old boy said, sometimes we don't have enough of something that all of us want. If it's eggs or toast, we don't have enough. My dad and my mom, they'll eat cereal, we get eggs. I feel bad because we're not getting enough food for the whole family. Next slide. A 9-year-old boy who said, we get mother from my grandmother, my auntie, or we have a program and people donate money. So he's talking about a GoFundMe page that his parents had set up because at the time of the interview, they were unhoused, they were living in their car. And he was aware that these were all the things that their parents were doing to try to get money to help their family. So 9, 10, 12-year-olds were telling us, they're noticing that their family doesn't have enough to eat. And these are the means through which they're getting that information. Next slide. Now, similar to what we heard from parents, we also heard elements of stress around food insecurity for children. This was a 10-year-old girl, and she said, "It's really expensive to live here. I know my mom has to pay bills, and that always has to come first to have a roof over our heads. I know we should be grateful for what we have, but sometimes I wish we didn't have to worry about getting food." Next slide. We heard elements of feeling embarrassed, feeling ashamed, similar to the parents. A 13-year-old girl, she said, "One time my friends came over, there wasn't anything in the refrigerator or the pantry. Their parents make money, their parents have a good education, their fridge is always full. And they came over and there was nothing in the fridge." Next slide. We also heard similar themes of feeling isolated, feeling alienated from one's peers or from one's family. This was a 13-year-old boy. He said, "There's not a lot of people going around going through similar things around here. I don't feel like I can talk to my mom or dad about it because they're probably going through much worse than I am. I consider myself a little bit lonely in this situation." And then the last theme was echoing that of the parents, feelings of feeling sad or feeling depressed. Another 13-year-old boy in our study said, "If the food runs out, I get sad a bit, just sad. The kind of sad where you want to try to be happy, but you know inside you're sad about it." Next slide. So for the interest of time, I actually think I'm going to skip over the next two slides. Okay, perfect. So all of this is to say, if we can think about all the ways that food insecurity is stressful and affects mental health, I mean, all of these experiences were attributed, or emotions were attributed directly to food insecurity. It wasn't because of housing, it wasn't because of, you know, a peer situation at school, it was because of food insecurity. So, as much as we should continue to treat food insecurity as a nutrition concern, meaning we want to strengthen our federal food assistance programs, we want to make sure that our food environment is healthful and accessible, we want to make sure that people have access to affordable food. We should also think about, how do we treat food insecurity as a toxic stressor? And that has implications for the work that we all do. So in research, like for me, I start to think about, how does food insecurity kind of get under the skin? Are there ways that food insecurity as an exposure could affect gene expression, could affect our stress response, could affect how we choose to eat certain things, and how does that lead to different disease profiles over time? But for a clinical perspective, like, we're screening for food insecurity in so many clinical practices now, and that's fantastic. But once someone screens positive, what do we do with that information? Can we strengthen the ways that we approach food insecurity in our healthcare systems? And also, how do we reinforce the parent and child, the caregiver and child relationship, so that when we see a family that screens positive for food insecurity, we know that the parent is stressed, we know the child is probably stressed. How do we promote that uh, positive relationship within the family so that the caregiver can feel better equipped to manage their situation and have that positively reflect on the child as well? And then from a policy perspective, of course, we should be strengthening our federal food assistance programs. We should be advocating for universal school meals and other healthful public health nutrition policies. But at the same time, food insecurity is not happening in isolation. It's connected to so many other social risk factors. And how do we think more upstream and think through policies that maybe don't even address food, but could somehow alleviate food insecurity just by reinforcing economic security? We saw that during COVID when we strengthened the child tax credit, and we increased the earned income tax credit. Like, if we just provided more funding, more economic opportunities, that has actually shown to reduce food insecurity without any nutrition education, without any sort of SNAP benefits or other benefits that are specifically allocated for food. So is there a way that we can do more things in both realms and have it be complementary to address food insecurity? Next slide. So I think those were my final thoughts. I want to make sure we can move to our next panelist. So I'll leave you with my email address on the next slide. And please feel free to reach out if you have any questions.
Okay, I guess it's my turn. Um, I'm also excited to be here. Thank you so much, Dr. Leung, for that. That presentation was so informative. And it's a little intimidating to piggyback off of it. So I'm going to talk to you, though, about our therapeutic greenhouse program that was developed at the school-based health center that I work at the Community Health Center in Middletown, Connecticut. So I'm a nurse practitioner, and most of my career has been in pediatrics. And we received a grant from HRSA, Health Resources Service Administration, to expand services at the school-based health center addressing access to behavioral health and childhood obesity. And we decided to use that grant to build a therapeutic greenhouse. Oh, next slide. So this is a very simple but so precise quote from Kate Burt, who's a garden researcher. She is a dietitian um, from New York. And this just talks about what is a successful garden. A successful garden creates community. It's an inviting space. It's resourced and supported. It's thriving and used. That kind of hits all the points when we were creating the greenhouse and thinking about how to use it and how it could impact these big problems, these wicked problems, right, of childhood obesity and food insecurity and behavioral health. Um, we needed the garden to be successful. And I love this quote because it really encompasses all of the elements that are needed in just a very short sentence. Next slide. The other thing that's interesting is doing the school-based the garden through the school-based health center was a unique vantage point. So that's not something that we found a lot of evidence for in the literature. And I just want to say I have consents for all the pictures, and there's tons of pictures of kids eating vegetables in this presentation. So why gardens? And if you can read some of this, I just grabbed some of the research that helped inform the development of this greenhouse for us, and continues to inform the curriculum. And you'll see it echoes a lot of what Dr. Leung said, right? So about access to fresh food and produce, about improving mental health outcomes, um, ecological and environmental awareness and stewardship can occur when children and families are exposed to greenhouse work and growing fruits and vegetables. And I think it also strengthens resilience. I think about when we're in the greenhouse teaching about growing plants from seed, and not everything grows, or there's a bug infestation, or something gets too much water or not enough sun. And then but we keep going, right? And then by the end of the season, we've grown tons of food, and just I think that strengthens resilience. I get to see it play out. Um, Also, gardens can improve fruit and vegetable consumption. When the kids grow things, they're more willing to try different fruits and vegetables. And kids that have access to healthier foods have better academic performance, and it helps with social emotional learning outcomes and peer relationships. Next slide. So I like to use the phrase that it's a hyper-local response to food insecurity. It's not going to solve it for sure, but it can help. And as I go through the presentation, hopefully you can see ways that it sort of creates, a brick in the or a chain in the a link in the chain towards helping with food insecurity, and something that we can do as clinicians in our health centers. So some gardens are food production gardens and some are education gardens. It really depends on the space, the resources, and the biggest resource is people too. So who's going to work in it and how much time they have to dedicate to it. And having a school garden can also build equity in some of the districts where there's not as much access to green space or even hands-on experiential learning, and it can become an interdisciplinary vehicle. So you'll see as I go along how we've used this garden to create a lot of offshoots and a lot of collaboration between different disciplines. And also we have been able to expand behavioral health services through the school-based garden. Next slide. So this is where we come into the wicked problems and the big topics, right? And somehow we find a way to funnel them down into a little greenhouse. But obviously, we don't always explicitly talk about this stuff when we're working with second graders. But having this knowledge of this history and these problems can help impart how we create the curriculum. So, we know that food insecurity increased incredibly since the COVID-19 pandemic. I know we're 5 years out now, but it doesn't always feel like it. I talked about the experiential learning, enrichment activities, as well as just kind of an acknowledgement of where food insecurity comes from. And we can trace it all the way back to slavery when we think about how it affects people of color at an increased rate. When we think about colonialism and when people were released from slavery, they weren't given a parcel of land, and that is at a time when no land meant no food, right? So that's sort of like that's where a lot of our food insecurity originates. And then we fast forward to things like redlining practices like that eliminated people from, access to healthy food. Now we have the food deserts. That all is connected, right? That's all connected all the way back. So just having that in our minds, as well as thinking about there's some inherent racism in the anti-obesity movement. And I think we touched on this with Dr. Leanne's presentation when we talk about what kind of food people have access to when they are a lower socioeconomic status or when they live in food deserts. It leads them towards less healthy choices. So what I like to think about the garden is that it can empower communities through education and access and create cultural connections, which you'll see. I'll talk a little bit more about as we go along. And I also think just having a greenhouse on a slab of concrete in the middle of a neighborhood is kind of an act of rebellion, right? And it's a beautiful space, and people are curious about it. People want to know what's going on. Next slide. So what we teach in this program that we run at CHC is food literacy, and how that's slightly different than nutrition is, in the school-based health centers, we have behavioral health experts and we have mostly, nurse practitioners and PAs, right? So we don't always have staff nutritionists, and food literacy is a little bit more combine like a combination, right? So when I take kids out as a nurse practitioner, I may focus a little more on nutrition than the behavioral health therapist does, but there's so much crossover, right? So if somebody only sees behavioral health, they're still going to get a lot of the same information as if somebody that only sees me for the medical side. And food literacy encompasses not just like a what to eat, what not to eat, but the whole story of food, where it comes from, how it's grown, how it's prepared, how it affects our bodies and minds, and how it can connect us to our past. Next slide. So the behavioral health therapists use the garden for individual therapy and or group therapy. So taking kids out for an individual therapy session or groups of kids. It also provides a sensory, positive sensory environment. So we've had times where instead of having a kid have an in-house suspension, they could go out to the garden instead. It could be very grounding. They can rub their hand on a little bit of lavender and smell it. They can taste some herbs or smell herbs, and it provides a hands-on learning experience. Next slide. And it can create these cultural connections. So a lot of what we teach when we're talking about food literacy is not just, like I said, what to eat, what not to eat, but connecting food to culture. There's an exercise that we do where we talk about what foods do you like and what foods do you not like, and we ask kids to talk about things like, is there a food you like because it reminds you of a special time or a special person? And one of the other things we found too through the volunteer program that we run in the summer is we will often have grandparents who are first generation or new to the country who are connecting with their grandchildren on this level of gardening and creating and growing food together. So, and then by tailoring the food that we grow to the population of families and children that we have in the school system that can also help create those cultural connections. Next slide. Some examples of things that are done in the behavioral health visits: sprouting seeds to instill confidence and empowerment, connecting to the cultural origin and family roots, which I just talked about. Uh, present moment awareness, when we're out there gardening, just even hands in the dirt, working together as a team to build community. I know one project that our behavioral health therapist did was having children grow seeds to take home, and at the bottom dish of the pot, she had them draw a representation of their anxiety, then place the pot on top of that, color the outside of the pot with hopes or dreams or ideals or whatever they wanted, right? Then you grow the seed, and then the flower or the herb grows up from that. So it's a very symbolic kind of overcoming anxiety, or growing something from the anxiety, or however you want to look at it. Next slide. So I'm going to give a little nitty gritty about where to start if you are interested in doing something like this in your school. And for the interest of time, I won't read all of these slides, but you do not need a greenhouse. You could do just a couple of raised garden beds. And there are a lot of grants, small grants that you can get from Whole Foods and Home Depot and maybe even local stores, that would be enough money to put a couple garden beds up. But you do need buy-in from the administration. We do send out a permission slip and a photo consent. And if you work in a school-based health center, the kids do need to be signed up for the school-based health center. So when we get our consents in, we have to make phone calls to make sure that those kids are signed up. Or if they're not signed up, make sure that they're getting signed up for the health center. And then we get our lesson plans and supplies ready to go. Next slide. This is just a sample permission slip. So just, I'm not going to read it, but this will come out when we send the PDF for the slides. Next slide. And what we've done with this greenhouse program is create 6-week sessions, and it's a 30-minute visit, which is billable. So whether you're the APRN PA or the behavioral health clinician, these are billable visits. And usually we keep the cohort small, 5 to 8, but you can run a few at a time. And what it does is puts kids in touch with not just growing food, learning about food, using the greenhouse as a therapeutic medium, but it also expands their access to the school-based health center. We have had a lot of kids who sign up for the garden only, and then they realize, oh, there's a health center attached to this. And so then they'll sign up for therapy, or they'll want to get their flu shot, or they'll realize they haven't had a physical in, a couple of years, they're behind on that. And then they realize, oh, I know the staff because my kid is in the garden program. And so it's sort of like has this multi-layered effect where it's like, it's not just addressing food, but it helps provide access to behavioral health and healthcare services. Next slide. Just a little sampling of just in 2 years, how that's happened, right? We have had new enrollments that people were just interested in the garden at first, and then they decide to be part of the health center. And then we're being able to create billable visits. And I put this in here because I know that we can't always rely on grants. And that's the beauty of this program is I don't need to rely on grants anymore because I've been able to create billable visits out of it. And so, especially, with the changes that are coming around right now, any program that we can create that can provide access that is self-sustaining, I think is a good model, something that we can use. Next slide. I also put in the codes because I would love for everybody to be able to create programs like this at their own school-based health center. And these are some of the codes you can use, as well as I always put in that greater than 50% of this visit was spent in counseling. And I put this line here to continue to reinforce healthy eating and activity. I worked closely with our biller, who worked closely with the state insurance to make sure that these codes were accurate and that these visits were going to be covered. Next slide. So for the behavioral health clinicians, it's no different. You bill exactly as you would for a single visit or a group visit, because it's not, you're just doing it in a different location. Instead of in the office, you're doing it outside at the greenhouse. Next slide. So the greenhouse has sort of had this rippling effect at the school that we work at. And it's created this kind of culture of health. We were featured in the local newspaper. Next slide. And we have summer volunteers. So we're in New England, so somebody has to take care of the garden during the summer. And so we are able to have summer volunteers, which brings in the community, brings in the parent. Usually we get parents of kids that are enrolled in the garden program. We also have had a seedling sale every summer. So we always grow too many seedlings. My medical assistant doesn't like to kill them. So we sell seedlings. We sell them for $1. If somebody doesn't have $1, we just give them away. It doesn't matter. But what it does is create this community around people. I didn't know this greenhouse was here. And then we tell them how they can grow things on their porch, how they can grow things in a pot. They don't need a big plot. It's a time for us to connect, and then for them to see it and think like, oh, well, I'm going to sign my kid up next year. Next slide. The school also applied for a farm to school grant. So this is the school, not the school-based health center, but the greenhouse helped kind of encourage this. So the school got this grant that now the school has every year. They have farmers come visit. The kids go on field trips to farms. They've added 3 new raised beds. Next slide. We've also worked with our local land grant university, which is UConn, and have brought in nutritionists to come and teach parent-child nutrition programs. And that happens in the interim. So we have a fall garden program and a spring garden program. And then when there can't be a garden program, we have these nutrition classes, parent-child, and they're free. Next slide. We've also worked with the local agricultural high school to get volunteers to come in the summer. And that's been amazing because some of the kids that have volunteered with us have been former students of the elementary school. Next slide. So I know in the interest of time, I'm not gonna read these. They're going to be in your PDF, but I wanted to give you a sample curriculum. Next slide. And some things to consider of what you might need if you wanted to start a program like this. Next slide. I think that's it. Yeah. Okay. So yeah, I wanted to honor the time, and happy to take questions. I'll make sure that my email gets to you. It's not on a slide, but I'll make sure it gets to you.
Rachel, you're muted. There you go.
Hi, everybody. Celeste, you can join me too. Go ahead and pop up. And you can actually go forward on a slide. So my name's Rachel Jones. I'm the founding executive director here at Farm to School of Park County. Thanks so much to the No Kid Hungry group and the School-Based Health Alliance for inviting us to share our work. It really is an honor to be part of this conversation and to be here to show you some of our real world, everyday examples of how we are integrated into local schools to address the interrelated issues of hunger, education, food access, whole child wellness in our tiny rural Montana community. In particular, we're going to be focusing today on what we call food and mood. We'll get to that later. I have a background in horticulture, and I was a commercial gardener and educator for 12 years before moving into the nonprofit sector. And since 2015, I've gotten to work with local schools and our communities in Park County, Montana. And we've been designing and scaling a comprehensive set of farm to school programs. I'm incredibly proud of what our community has accomplished altogether. And I get to work with incredible people, and that includes Celeste Mascari, our education program manager. Celeste, you can introduce yourself.
Thanks, Rachel. Hi, I'm Celeste Mascari. I'm the education manager at Farm to School, and my background is actually in early childhood education, initially through the Montessori method. And I've been working in schools and teaching since 2015. I ran and founded a Montessori school for 7 years, and before working for Farm to School. And I love what I get to do, the community and the diversity of work that we do with Farm to School. And I love that I get a chance to integrate my Montessori as well as my childhood development into the public schools. So thanks, Rachel.
Yep. Next slide. Great. So in order to really understand what we do, I think it's important to know where we are. So we're in Park County, Montana. It's the real Yellowstone country. I know everybody knows about Yellowstone now. The secret's out. So we're located right at the northern entrance of Yellowstone National Park. And yes, that is a photo of a Yellowstone cutthroat trout, and it was caught in the Yellowstone River above the Yellowstone Lake. So if you know, you know, it's a pretty big deal. You can see on my son's face that that was a pretty exciting day. The population of where we live is about 17,000 in the county. There's about 8,000. The slide's wrong. So it's about 8,000 residing in Livingston, which is the county seat. Park County is positioned in a beautiful landscape. We have tremendous agricultural history here and a lot of agricultural potential. We do border Gallatin County to the east, just over a mountain pass, and that means that we're neighbors with the city of Bozeman. The last I checked, Bozeman is the third fastest growing micropolitan in the US. And yes, our proximity to Bozeman poses threats to Park County in regards to growth and affordability, maintaining our rural lifestyle and our community character, just to name a few. So as all that farmland is disappearing and the living costs rise, it's important for you to know that about 50% of our public school students qualify for free and reduced school meals. Our food pantries are increasing in their demand, and this is all indicating a significant food insecurity issue here in our county. Next slide, please. So what is Farm to School? It's a national movement, and it's been happening in all 50 states, and it's in about 75% of US schools right now. And that means it's in over 74,000 schools across the county. So basically, Farm to School takes place in school gardens. You can back up. I'm going to explain a little bit more. So Farm to School does take place in school gardens, cafeterias, classrooms, and local farms. Focuses on connecting students with where their food comes from. It's not a one-size-fits-all project. It can look different in every community where you are. It is defined as including at least one component of education, school gardens, or local food procurement. And where we live in our rural Montana setting, we have been able to collaborate with schools and our community partners to support local farmers and ranchers and food businesses. We've been creating hands-on programming and garden enhanced nutrition learning experiences. And last but not least, but we also do focus on improving the school meal nutrition in our schools. Next slide, please. So specifically here at Farm to School of Park County, we see a future where all Park County communities have a deep and meaningful connection to food and where it comes from. And we do that by guiding schools and their communities and building a prosperous local food culture that places healthy food on the plates and in the minds of our community's children and their families. Next slide. So our set of programs is really based off of our program pillars: teach, grow, eat, repeat. It's not brain science, you know, it's not rocket science. It's pretty basic. We teach kids in school, we meet them where they're at, we grow food with kids for kids. We teach them how to eat food and how to prepare food on their own, and we also influence school meal patterns. And then we just continue to do that over and over again. Next slide, please. So as we just learned from Dr. Leung, and as we saw in Nicole's examples, we know that food insecurity is not just an economic or nutritional concern. It also impacts mental health. And addressing those challenges requires community-driven solutions that strengthen local food systems and local resilience. It's important to know that we have a historical context that has led up to this point. And I think it's important for you all to have. There was a wave of teen suicides that plagued our community in the mid 2010s. And at that time, our community really rallied to find new approaches to community wellness and belonging, mood regulation. Naturally, the whole community looks to Farm to School as one component of that community-wide strategy as a nonprofit with direct access to schools, with the ability to help change nutrition and food education in the schools. Great, thanks. So in 2020, we were connected with SAMHSA, and we were introduced by a mutual colleague with a shared desire to support efforts that make the connection between farm to school, nutrition, mental health, and behavioral health. We participated in the first Food and Mood virtual town hall with SAMHSA, and I should say it's the Substance Abuse and Mental Health Services Administration nationally. We're really happy to do that with Food and Mood at that virtual town hall in 2020. And we did have a former board member, Barbara Moore Prager, who actually coined the term Food and Mood. So I just wanted to mention that. Next slide, please. Why is nutrition security so important? I think we just learned a lot about that from Dr. Leung, but I will say that nutrition security is critical to behavioral health because consistent access to nourishing food directly impacts brain function, emotional regulation, overall well-being. I know we all see this in the work that we do in schools and in healthcare facilities. Next slide. I do encourage you all to become familiar with the whole school, whole community, and whole child model, and perhaps explore these other resources that could provide insight and inspiration and resources for your own food and mood activities. Celeste has so much to share about what we're doing, so I'm going to hand things off to her. And just know that food and mood has really evolved over the years for us. Fortunately, our community and schools have shown dedication to school food reform and behavioral health. So get excited. She's got some fun things to share.
Awesome. Thanks, Rachel. So this is a slide. I took this from the SAMHSA website. These are the 4 pillars of food and mood that they have according on their website. And I just wanted to give you a brief familiarization with these just to get you introduced to them and to share how they relate to what we do and align with our program pillars. So the first one is equitable access to resources. Second is multidisciplinary community engagement. The third is meaningful and holistic curriculum that is culturally informed, and an inclusive and normalizing public dialogue. So there's a lot more information on their website. I'm just gonna move on to the next slide for now. Thank you. So in our pillars, like Rachel talked about, eat, teach, grow, eat, and repeat. Our first pillar is teach. So our teach philosophy is, as you can see, our curriculum is based in our school. So we have instructional time built into our school days. We're really proud of our curriculum because of its depth and its evolution over time. It's been developed for over 18 years in partnership with the schools and our staff, as well as national groups like Food Corps, Vista, AmeriCorps. And we really take a relationship-based approach when designing our lessons. And these do build cumulatively over the years, over the course of a student's pre-K through 5th grade years in the classroom. And our lessons are all hands-on, they're highly customizable, and they're designed to meet local and state standards. And so our farm to school lessons are actually built into the school day, kind of like a special, like PE or art. So the kids are getting them throughout their school year. Next slide, please. So what does that look like in action? So we start and end each of our lessons with an invitation for kids to engage. We do things such as activities like songs, stretches, and check-ins, and those really help the students feel safe and seen and start out with a specific tone. And we begin our time together with establishing a shared expectations for our gardens and our classroom space. And we find that this allows for safe exploration, playfulness, and curiosity. And like I said, we've been building these relationships for years, but this is an area I can't emphasize enough. We really focus so much time and effort into building these relationships, both with the students and with the school staff. And we find that the more time that we spend together, especially with students, the more comfortable they are to try new things, such as trying new foods or getting out of their comfort zone a little bit. And we're doing this by spending lots of face time. So we're in the cafeterias, we're in the classrooms, we're in the hallways and the teacher's lounge. We go to after school events and parent-teacher experiences. So we're there a lot. Okay, next slide, please. So grow, our next pillar. So our philosophy behind grow is that we grow Montana adapted crops that support both food services and the local ecosystems. And so we like to think about balancing productivity with biodiversity. So an example could be a kale plant, for instance, can provide nourishment, it can support pollinators, and it can serve as a hands-on learning experience and provide food. Our network of school gardens and community gardens help to foster deeper connection to where food comes from. And we work really closely with food services in Park County to plan crops for school lunches specifically. And all of our schools that we work with in Park County all have learning gardens that are attached to and integrated into the schools. Next slide, please. So in practice, so we started really small, just one greenhouse, one garden bed, and we've expanded to over 10 different growing spaces just in the city of Livingston. And I've chosen here just a few to highlight. So like I said, all of our schools that we partner with in Park County all have their own learning gardens, and these are designed specifically to be educational spaces. So they're used for seasonal lessons, helping students to understand ecosystems and connect with where their food comes from. They also offer opportunities for self-guided learning and an outdoor space that the rest of the school staff is free to use with students or for themselves. Our Lincoln School Farm is our production scale farm, and about 95% of what we grow there goes directly into school meals. Last year, we grew over 3,000 pounds of produce, which is so wonderful. And it plays a big role in our summer programming, volunteer opportunities, and is just a third space for community members as well. Deep Creek Green is a fun new partnership we just started in the last couple years. It's a partner with a local community member and has a lot of potential for larger scale growing as well as educational programs. Thanks. Next slide. So our next pillar is eat. And so our vision is that food in our community is delicious, nutritious, and also affordable for everyone. So we do this through a few methods. We help to encourage and support food services at our schools to purchase Montana-grown foods. We also help Farm to School provide support and funding to encourage more scratch-cooked meals in our cafeterias. We're working to change how people see school meals and to make sure the process of preparing and serving foods is seen and valued and appreciated. And of course, very importantly, that the meals are kid tested and approved. We really want to make sure that students have a say in what they eat and offering them choices so that they feel involved and excited about their meals. Okay, thanks. Next slide. So in practice, here are some of our programs. So Summer Lunch in the Park is our free summer lunch program that we partner with the schools and the local food pantry and the city and other partners to provide free summer lunches in the parks. Our Healthy Food Fund, so Farm to School provides grants to public schools in the county to encourage them to buy food from Montana-grown producers. Harvest of the Month taste tests. We do once a month, we have cafeteria taste tests with volunteers to help, and it allows students to have a chance to vote on what goes onto their school lunch menu. Classroom cooking lessons once a month. Again, all of our pre-K through fifth graders are getting a cooking lesson in the classroom. And Farm Fresh Meals, our work is aimed at improving the quality of meals, which in essence is our Farm Fresh Meal program. Next slide. And so to repeat, how is this all made possible to continue? All of this is possible because of our relentless approach to collaboration, teaching and growing and evolving with the community. And so our advice is to really focus on those community relationships and continue to build those up. And next slide, please.
Okay, so in case we need a reminder, it's all here. There's so many reasons for food and mood programs to pop up in your community where you're at. The connection between nutrition security and behavioral and mental health is very, very real. Next slide, please. Great. So we just really encourage you to build support in your communities, network relentlessly and collaborate relentlessly. We always teach to the child. We practice that social and emotional and academic growth in every action, in every interaction that we have with children. I think Celeste mentioned this, but offering choice is so important, especially with food, as it encourages curiosity and gives kids a sense of ownership over how they feed themselves and how they learn to feed themselves as they grow older. And also, I want to highlight that I hope that you will leave this and really want to, and I really encourage you to seek out and utilize tools, validated tools, and support and encourage more research that helps with a more global understanding of how food choices can impact students' behavior and mood. Next slide. And I think we have one more slide. Yep. So if you haven't already, be sure to know that you can visit the Food and Mood webpage with SAMHSA to learn more about the Food and Mood project. They do have a really helpful bi-monthly newsletter, and you can reach them online. And then there's Celeste and I, you're able to contact us too with any questions about any of our activities or how we're able to do what we do.
Thank you.
Thank you.
Thank you so much, Celeste and Rachel, and to all of our presenters. It was an absolute pleasure to have you on today and to hear more about the amazing work and research that you do. With that, I know that we are winding down here time-wise, so we're going to go ahead and launch a closing evaluation poll. We would love to hear your feedback on what you learned today. As a heads up, we would love to share our toolkit resource with you. You can scan the QR code on the upper right corner of the screen, or you're more than welcome to just go ahead and visit our website and explore around and find it for yourself. It highlights a lot of the work that we've done over the past few years with No Kid Hungry, and has a bunch of great resources from the field and your fellow school-based health centers. Lastly, save the date. We would love to see you in DC in late June and July to learn more about what's happening in the field this year and to connect with all of you in person. And we would love if you stay connected with us. We've got a bi-weekly digest, and we've got social media where you can hear more about what the School-Based Health Center or School-Based Health Alliance is up to, and more about resources from the field. We will be sharing with you via email any and all follow-ups from this. So we'll share the recording and a PDF of all the slides so you can go ahead and get the resources that were linked there and all of the information to do some of this amazing work at your school-based health center. Perfect. Thank you all so much for joining us, and we hope you have a great rest of your day.